Hello, welcome to this lecture on the part 2 of the rudiments of dispensing. And for today, our attention is going to be on medicine labels and package inserts. My name is Pharmacodynamics from Fexen's Health College. Now, when you look at the overview, the medicines, labels, and packaging inserts contain information you need before you can dispense a drug to a patient. Normally, when we say a medicines label, anytime you take a medicine, it has gotten a lot of information that you as a medicine counter assistant should know before you give it to a patient. So to prepare and dispense medicines, you must understand information that appears on the labels, including the medicine's name, the dosage form, the dosage strength, the total amount of the medicine in the container, the route of administration, warning, storage requirements, and manufacturing information. And for this one, we are going to be discussing at length. All right. So we are going to be going into details as to the information that we are supposed to know before you give a medicine out. First of all, let me take this as an example. Okay. And this one, if you go through your model, the book we have given you, majority of these are there. All right, so I'll just present based on it. Now I hope some of us have taken this medicine before. It's a dewormer. We normally take and deworm. Now this is the product phase. The package itself has gotten a lot of information, so this is what we call the product package. The product literature or the leaflet is a paper that they normally will fold and put inside this package. So first of all, let's concentrate on this product. When you see a product like this, it gives us a lot of information. And first, let's go through. The first one is the name of the manufacturer. Okay, so for this product, we can see that the name of the manufacturer is the GlaxoSmithKline. Okay, that's the name of the manufacturer. Okay, then followed by the brand name. When you say a brand name is the name of the medicine that is given by the company. Okay, so this company decided to call their class of medicine Zentel. Okay, Zentel. So Zentel is the name of their medicine, and that is given by the company GlaxoSmithKline. Okay, commonly called GSK. Now, followed by the dosage form. A dosage form is the form in which the medicine is presented. We have suspensions, we have syrup, we have suppository. Okay, suppository is what to put into the anus, what we insert. We have creams, and ointments, what to put on our skin. So a tablet is a dosage form, a capsule is a dosage form. This manufacturer is telling us Zentel that they have is a tablet. The next one is the generic name. Okay, the generic name is the name that we give to a medicine, which is almost the same as the chemical name of the medicine or the active ingredient. And I think you have done about active ingredient with the CPNs already, all right? So this medicine has gotten a generic name. That is the chemical that is inside the medicine responsible for its physiological action. Okay, that is going to produce the effect. This is what is going to kill the worms when you take the medicine. It's called albendazole. So GSK called their albendazole Zentel, and this is for marketing purpose. That's why they call it Zentel. But when a doctor is prescribing this medicine for a patient, this doctor wouldn't prescribe Zentel because that's the company's name they have given. But the doctor writes the original name or the generic name or the proprietary name. So the proprietary name or the generic name for this medicine is albendazole. Albendazole. Then we also have the strength of the medicine. Okay, the strength of the medicine. And as you can see, the arrow pointing. The strength of the medicine tells us the amount of the active ingredient in each tablet. Okay, the amount of the active ingredient in each of the tablets that you take. So when you take one tablet, how much albendazole do we have in the tablet? Okay, so the manufacturer have told us that when you take each tablet, it contains 400 milligrams. So mg means milligram. Later in this model, we'll be doing units, so you understand. All right, now why is this important? When you take one tablet of Zentel, Zentel contains excipients, it contains color and flavor, which we did in our other presentation. Okay, but the generic name, of the medicine, as I've said, almost as a chemical name, that is what is going to produce the action. So we should know how much of the active ingredient the manufacturer has placed in the medicine. This one will help us. Now, assuming this medicine that we have, albendazole, okay, and the manufacturer have said each tablet of the tablet contain 400 milligrams, okay. Now, assuming somebody wants 200 milligrams, it means that they have to take half of the tablet, okay, because the manufacturer have told us that each tablet contains 400 milligrams. Assuming the doctor have given you a prescription for albendazole and is saying that the patient will need 800 milligrams, then means that the patient is going to get 2 packs of Zental because 1 pack of Zental is 400 milligrams. All right. So I think that you are now realizing the importance of the product information that we get on the package. Okay. Followed by the number of doses inside. And when we talk about a dose, the dose is the amount of the medicine the patient is going to take at a time. All right, so this one, Zental, okay, the dose of Zental is 1 dose, which means I just take the 1 tablet, that is all. And obviously, we have the 1 tablet. And the last one, every product packaging will have this information that is the expiry date, the manufacturing date, and the batch number. Okay, the expiry date, the manufacturing date, and the batch number. Please and please and please, before you give a medicine to a patient, please check the expiry date. A lot of MCAs have been very hot because they give medicines out that have expired. And this is part of our working protocol. We don't give any medicine to a patient without checking the expiry date printed on the product. The expiry date is the date after which a medicine cannot be used. Okay, so the date after which a medicine cannot be used. So assuming the medicine is expiring in 30th July, the medicine can be used on 30th July, but after 30th July, let's say 31st July, the medicine can't be used because the date that was set by the manufacturer for the medicine to be effective has passed. All right. So on the pack of Zental, we have gotten the expiry date, the date was manufactured, and the batch number. The batch number normally is a number placed on the product to help us identify if there's a problem. Okay, normally companies will manufacture products in a lot of batches and call them lots. Okay, so let's say the company have manufactured 10,000 tablets on one day. They'll give it a particular number so that if there's a problem with that particular medicine, that number will be mentioned. If I have that number in my pharmacy, then I have to take the product back. All right. So every medicine we sell in the pharmacy has also gotten what's called the batch number. All right. So basically, when you have a product like this, these are some of the information that you are going to see. Let's look at another example. Now, for this example, I'm asking you these questions. Write it. You can pause the video and write it. Then later I'll discuss. Okay. So just pause the video. Then we'll discuss. Okay. So now let's continue. So now let me ask you a simple question. What is the generic name of this medicine? It is important. You can see that the last one we did, we saw GSK give us the generic name and the brand name. And for this product, the manufacturer is Medrich. You can see Medrich. The medicine that we have is amoxicillin capsules. Now let's take note. You can see that both the products are placed there is just having the active ingredients, no brand name. Products that normally don't have any brand name, we call them the generic products. So this is a generic product. You can see it just comes as amoxicillin. This company decided not to give it any brand name. All right, and that such products are good. It contains 21 capsules and the strength is 500 milligram. Now there's another amoxicillin capsule just by the side, but this one the strength is 250 milligram, which means that when you take one of the capsules, it's 250 milligram. Okay. Now this is important because assuming a doctor writes a prescription to your pharmacy and says that give 1 capsule of amoxicillin to be taken 3 times a day for let's say 1 week, and you have these 2 types of amoxicillin. One is 500 milligram per capsule, one is 250 milligram per capsule. It will be difficult for you to give this medicine to the patient. Why? Because you don't know which one the doctor will want. So later when we start calculations, anytime a doctor will write medicines that will come in different strength, as we are seeing, 500 milligram and 250 milligram, the doctor always writes the dose in milligrams. So the doctor will say give one 500 milligram or give 250 milligram. All right. So this is also a product. But as I've said, for this product, you can't see any brand name. It's only the generic name that they have placed on the product. Another product, and I think some of us might have taken this product before. Now, for this product, it contains a lot of active ingredients. Okay, so it is difficult for the manufacturer to write all the active ingredients in the product. So give a simple name like War Woman and War Man. So if you see on the wall woman, you can see it contains micronutrients, evening primrose, starflower oils. In fact, it contains a lot of other nutrients. Okay, a lot of other nutrients is inside. Okay, and it contains 30 capsules. If you look at the wall mart contains a lot of ingredients, including CoQ10, L-carnitine, Siberian ginseng, vitamins, minerals, and amino acids. Okay, so that's why we call it a multivitamin. All right, so here, this company that manufactures this company is called Vita Biotics. You can see them. The brand name of this product is Wallman. Okay, and that is what I want to know. So this is a product with a lot of information on it. Let's look at another example. Now, for this one that we are seeing, it's still amoxil. Please take note. Now, once you see the TM, that's a trademark, just like the Zental we looked at. So amoxil is a brand name. The generic name for this medicine is called amoxicillin. Okay, so amoxicillin is the brand name, amoxicillin is the generic name, and it's manufactured by the same company. You can see below, GSK. Okay, GlaxoSmithKline. Okay, the same GSK. Now on this one, you can see there's some information after the brand. There's a strength, and you can see we have pointed to 125 milligram per 5 ml, or better still, you can see we have 125 milligrams of amoxicillin in every 5 mils of the medicine we take. Okay, so assuming we measure 5 mils, we use a measuring cup, which a lot of us know. If you don't know, just take, if you are in the room or if you are work, find any medicine with a measuring cup. You can see we have written some numbers: 2.5, 5 mils, 7.5 mils, 10.5, sorry, 10 mils on it. Some even up to 15 mils to 20 mils. All right. Now, what the manufacturer is saying that if you pour 5 mils of the medicine, we have 125 milligrams of amoxicillin inside. That is what we call the strength. This is also important. Now, assuming the doctor have told the patient to take 250 milligrams of amoxicillin. All right, how many mils do you think you pour? I've said already. There's when you pour 5 mils, there's 125 milligrams. All right. Okay, so when you pour 10 mils, how many are we going to have? So please, this was one of our assignments. Okay, so today I'm not going to give questions at the end of my presentation. Anytime I ask a question, I want you to answer. So this is the question number one. I want you to tell me, if a patient takes 10 mils of this medicine, okay, 10 mils of this medicine, how much milligrams would the patient have? Okay, so it's very simple. 5 mils will give me 125 milligrams. So 10 mils will give me how much? It's simple mathematics. All right, just do it and send your answer to my email. All right, so at the end of the presentation, I'll ask a lot of questions. Please, as I'm saying, I want to make sure you are listening to my lecture. All right, so take your pen and paper and write the question number one. The question number one is, as I'm asking, if a patient takes 10 mils of this medicines, how many milligrams is the patient going to take? If the patient takes 10 mils, how many milligrams? Solve it and send it to me in my inbox. Okay. Now, this medicines to contain 100 mils. 100 mils is that the whole bottle contains 100 mils. That's the volume of the bottle. So there's 100 mils of amoxicillin inside the bottle. All right. There's 100 mils of amoxicillin inside the bottle, and that's a quantity in the medicine. The quantity in the bottle. Sorry. All right. So this is how the information. It's very important we have to know, because later on, maybe in about our part 4, I'll start calculations with you, and these things will come up again. All right. So for today, I'm just introducing you to the informations that can be gotten on product labels. For this one, let me ask you a question. So this is question number 2. Question number 2. All right. So question number 2. What is the generic name of this medicine? Write it down. What is the generic name of this medicine? Okay, so write it down for me. What is the generic name? What is the generic name? Are we okay? Okay. And question number 2. What is the strength of this medicine? What is the strength of this medicine? We just did one for amoxicillin where I told you that, let me go back and show you, where we said that amoxicillin, the strength was 125 milligram per 5 ml, right? So that is the strength. Now for this Zental suspension, please find the strength and send me. So that's your question number 2. Okay, so the question number 1, the question number 2 was albendazole, the generic name of this medicine. Okay, the question number 3, sorry, is the strength of the medicine. So question number 2 is albendazole, okay, and the question number 3 is the strength of this medicine. What is it? Just tell me with the strength. Okay, and tell me the generic name of this medicine. What is the generic name of this medicine? All right. So the first question I asked you, let me go back so that we get the questions right. We'll continue the lecture. The question I asked you here is that if the patient takes 10 mils of this medicine, what milligrams would it contain? Okay. Second question is that what is the generic name? What is the generic name of this medicine that you are seeing? What is the generic name? Question number 3. What is the strength of this medicine we are seeing? The Zental suspension. What is the strength? Okay. What is the strength? Are you okay? So 3 questions. Very good. Now, there are other information we can see here. One is do not use in pregnancy. Later in this presentation, I'll talk about contraindications. Okay, and I mentioned this one. The contraindications normally is a condition under which somebody cannot use. In fact, when somebody is pregnant and you take a dewormer, it can cause a lot of problems to the unborn child. All right, and this manufacturer too is telling us that before we take dental suspension, we are supposed to shake the bottle very well. Okay, we are supposed to shake it very well. The manufacturer is also telling us that we should not store the medicine above 30 degrees Celsius and we should protect the medicine from direct sunlight. Okay, also we should keep all medicines out of the reach of children. All right, so this is an important information that this manufacturer have given us on dental suspension. The next one. Now, I think some of us might have taken ferroglobin before. It's a very popular medicine. Okay, so that's ferroglobin. All right. Now, ferroglobin contains a lot of active ingredients. In fact, it contains over 30 active ingredients. All right. So you can see this ferroglobin for the formation of hemoglobin and red blood cells. Okay. So this one is telling us something beautiful. Okay. Now, this bottle of ferroglobin contains 200 ml, as you can see. And the active ingredients, when it comes to the right, you can see nutritional information. The manufacturer have listed all the active ingredients that is in ferroglobin. All right. So just the product packaging is giving us a lot of information about it. It is even telling us what the medicine is used for. Okay. So for formation of hemoglobin and red blood cells, it also is good for making sure that you don't get tired. And if you are fatigued, ferroglobin is going to help you. All right. Now let's come to the second part of it, and that is the product inserts. Okay, and I've just placed an example of a product insert of ampicillin there. So you can see that normally, and I'm sure a lot of us have seen it before, if you have medicines around in your handbag or in your room or in your office, okay, just pick a medicine. You can see there's a paper that we have folded, placed inside the medicine. And I'm sure a lot of us have never taken the pains to read about it because it's boring. It's a lot of scientific information that we don't need it. All that we need is that how should I take my medicine we take. Okay. That can be very, very dangerous for us. Now, because we are learning about medicines, the first thing I want to introduce you to is how do we use this product insert? Okay. By the way, what is the product insert? A product insert is a document included in the package of a medication that provide complete and authoritative information about that drug and its use. Okay, complete and authoritative. So this information is very key. And let me say this: there are a lot of us working in pharmacies that when patients come to our pharmacies, we don't have enough information and we dispense the medicine. That is called a dispensing error. We can end up killing people. All right, so please, I now want you to form the habit of reading product literature if you want to work in a pharmacy. If you have some around, please pick it up and study along as we are doing this lecture. And I hope it will benefit not only for your patient but yourself. Okay, when you go to a hospital or pharmacy and they give you a medicine, even though that they may counsel you and tell you a lot of other things about the medicines, when you come and read as a pharmacist, even as of now, I've practiced pharmacy for over 15 to 16 years now. But anytime I give a medicine to my child or my wife or myself, I always read the product literature. Okay, so that the best use of the medicine I can get. All right. So let's look at a few things that the product literature is called. And this is not exhaustive. Exhaustive means that there could be some things on your product literature that I may not discuss. Okay. And there are some things you may see here that may not be in the product literature. But in general, this is an average information you may see in a lot of product literatures of medicine. So first, let's look at the description. Now, most product literatures will first describe the type of medicine that they have packaged. Okay, and this one will include chemical and physical description of the drug. Sometimes it will tell us the color of the drug, it will tell us the smell or the taste of the drug, okay, and it will tell us the type of chemical that was used, normally the active ingredient. Okay, so the first thing listed is usually the brand name you might see and the generic name of the medicine. Okay, so example, if you have a medicine like what I'm showing you, amoxicillin, when you remove the literature, you can see the written each capsule contains amoxicillin 500 milligram as the trihydrate. So this one, they are telling us the chemical component of the medicine. They've also even added the excipients to it. And they are saying that for what you are seeing, okay, it contains excipients like the camozin E122 gelatin capsule body and cap. Okay, that's what people think it is rubber, but it's not rubber. Okay, what we put the medicine inside. Then it has gotten magnesium stearate and colloidal and hydrous silica. Okay, this is plenty, but all that I'm saying that this one is telling us the active ingredients, the excipients, and any other chemical that was used to cause manufacturing. Why is this important? Because sometimes patients may react to the excipients. Sometimes some patient may react to it. Sometimes patient may not be reacting to the active ingredient, but the excipient. So it is important for us to know. Assuming a patient comes and says, I don't want any medicine that contains magnesium stearate, and you are giving amoxicillin, you want to check to be sure it doesn't contain. Okay, so that's the first thing on the description. The second one is on clinical pharmacology. Clinical pharmacology. Okay. So basically, when you talk about pharmacology means how medicine works in the body. Okay. So here, how medicine works in the body is called pharmacodynamics. Okay, pharmacodynamics. Very easy. Pharmaco has to do with medicines. Dynamics has to do with changes these medicines does to the body. So pharmacodynamics, two words joined. Pharmacodynamics, how medicines works in the body. Okay, so that's one part of the pharmacology. The second part of pharmacology is called pharmacokinetics. Pharmacokinetics. Okay, it talks about how medicines move in the body, how medicines handle in the body. Okay, so the first one is talking about how medicine works, and the second one is how medicines move. So here from absorption, they are distributed, metabolized, and eliminated. Okay, and what is its effect? Okay, and later inside, I'm going to talk about this more. Now, clinical pharmacology may also include results of various clinical trials, like studies and or explanations of the medicine's effects on various populations, like children and women. Okay, so these clinical trials can tell us that when they tried the medicines on children, nothing was seen. When it was tried on rats, we saw that the rats were had mutations or their babies were destroyed because of that. When they are pregnant, don't use blah blah blah. So clinical pharmacology normally tells us about pharmacodynamics and the pharmacokinetics properties of a medicine. Let's look at pharmacodynamics into a little bit deep. Now, I have summarized my notes because I really don't want to bore you, all right? But it's important we understand this because you'll be working in a pharmacy. As I've said, pharmacodynamics is the study of the biochemical and physiological effects of drugs on the human system, okay, on the body. It is also defined as a study of the mechanism of action of drugs, of how do medicines work in the body. And for us to understand pharmacodynamics into details, let's look at about 10 things we are supposed to know. One term is what we call drug action. So anytime you see drug action basically talks about how drugs produce their effects. Okay. And normally, as we did in our first lecture about physiological change, I said drugs produce their effects by altering the normal function of the cells and tissues of the body. Okay, so they may change the way the body works. In so doing, they'll produce their effect. So sometimes when you want to know how a medicine works, you can come to what's called the mechanism of action of the drug or the drug action. Another one we are supposed to know, another term is drug half-life, the drug half-life. So the half-life of a medicine, okay, basically is the time it takes for the plasma concentration to be reduced by 50%. Okay, so the time it takes for the plasma concentration to be reduced by 50%. Okay, so assuming we take a medicine and it takes 4 hours, assuming the medicine plasma concentration in the blood, let's say, is 500 milligram and it takes 4 hours to be reduced to 250 milligram. then we say that that is the half-life. The half-life is 4 hours. Okay. Then another thing about pharmacodynamic properties of drug we know is the diurnal body rhythms. When we talk about diurnal, we are talking about during the day. Okay, so diurnal body rhythms play an important part in the effect of drugs. Now, diurnal body rhythms, let me give you an example so that we understand. In the morning, okay, our body produces a lot of steroids. Steroids make us strong. Okay, our body produces them. One example is called the cortisol, hydrocortisone. Our body produces a lot. So sometimes patients like asthmatic patients or patient with cancer or any other condition, a doctor may prescribe a steroid for them to take. Now, because our body normally produces steroids in the morning a lot, when we are dispensing also artificial steroids from the pharmacy to our patient, we ask them to also take the medicine in the morning. Why? Because our body naturally produces steroids in the morning. So if you want to take steroids, it is best time for us to take it also in the morning. All right, so that it goes with the body's rhythm. Okay, it goes with the body flow. Another example I'll give you on diurnal body rhythms is sleeping pills or what we call sleeping tablets. Now, let me ask you a question. What time of the day do you think the majority of humans sleep? What time? Very good. We all sleep at night. All right. So, sleep aid medicine or what we call sleeping tablets or sleeping pills. These medicines normally work best at night when we are about to sleep. It works best. Now, normally, when you take sleeping time during the day, like in the afternoon or in the morning, they may work, but their effect is not as strong as when we take it when we are going to bed. This is what we call the diurnal body rhythm. Sometimes medicines work along with our bodies, okay, to produce maximum effects. The fourth one is psychological factors. Psychological factors. Now, psychological factors involve how patients feel about the drug or the drugs prescribed for them and the different ways they respond to them. Now, this is interesting. I once worked in a hospital, I don't want to mention the name, where patients will come and they'll say that for my condition, if you don't give me an injection, I'll not be well. Sometimes we do the labs and they are not sick. But you see, we just give them ordinary water, just water. We call it Aqua Pro as injection. And once you give the patient may come back the following day or two and say, Charlie, thank you very much. That medicine you give me was very good. But when you give me the medicine, I felt it that the medicine have treated all the disease. Now I am strong. We did not really give any medicine. What we gave was water for injection, just water, normal water. The one we used to mix medicine. That's what we gave as an injection. Why is the patient telling us that they are responded to the medicine? Because they are psychological. A lot of us have gotten effects like when we go to the hospital and the doctor doesn't give us any medicine to take and says that madam go and rest, you'll be fine. When we come home, we still go to the pharmacy and we want to buy medicine because psychologically we are not fine. But assuming the doctor prescribe any placebo, when you say placebo, a placebo is any medicine that does not contain any active ingredient at all. It can be starch tablets like Kukunti tablets. But assuming the doctor prescribe Kukunti tablets for you or starch tablets for you and you are taking and feeling well. Okay. So sometimes medicines may work purely based on psychological factors. Okay. Then we have another one called drug toxicity, also under pharmacodynamics. Almost all drugs are capable of producing toxic effects. Now, if you remember when we started Model 1, we talked about the royal toxicologist. I hope you still remember. Okay, Magistrates the fourth. You remember where he was using poisoning his patients and all those things. I asked the question on that. Okay, so toxicity tells us the range between where a medicine is will be therapeutic. Therapeutic means that it will cure. Okay, and at what dose will the medicine be poisonous? Will it be toxic? Okay, that's what we call the therapeutic index. Okay, so therapeutic index basically is a range between the therapeutic dose of a medicine. That's the dose of the medicine that will cure, that will become like a therapy, and the dose that is going to be poisonous, that will be toxic. Now, this range is normally measured by the therapeutic index. Okay, so the greater the therapeutic index, the safer a drug is likely to be. For example, if you have two drugs, drug A and B, and drug A has gotten a therapeutic index of, let's say, 1, and B has gotten a therapeutic index of 4. Okay, so A is having a therapeutic index of 1, medicine B is having a therapeutic index of 4. Now, my question, this is going to be your fourth question I'm asking you. So please note it down and send me the answer. So medicine A and medicine B, which one is more safe? Medicine A is having a therapeutic index of 1. Medicine B is having a therapeutic index of 4. Which one do you think will be safer for a patient? Please, question number 4. That's what I've just asked you. So take note and send me the answer. Okay. Now let's come to the sixth part under pharmacodynamics. The side effects. Side effects are usually defined as the mild, unwanted, or secondary effects of a medicine which are produced when the normal dose of the medicine is taken. So basically, okay, once you take a medicine, the medicine may also produce other unwanted effects. We call it the secondary. Okay, so the primary effect is what we wanted the medicine to do. The secondary effect is what we did not want the medicine to do. For example, some of us may have a good friend, but you see, that friend have gotten a side effect. Maybe they gossip a lot. So whatever you tell them, they'll go around gossiping. All right. So a medicine like paracetamol is a very good medicine. But paracetamol has gotten a side effect. A medicine like Piriton, okay, and some of you may know Piriton, small rounded tablets we use for when you have cold or Ryzen. It's very good when we are sneezing and coughing. Ryzen and Piriton may do the work, but they have a side effect. That is, they may cause dizziness when you take them. All right. So side effects normally, as I've said, they are mild, unwanted, or secondary effects of a medicine, which are produced when you take the normal dose. The 1 tablet and 2 tablets you are taking will still produce the side effects. All right. The seventh one is what we call the adverse drug reactions. Adverse drug reactions (ADR) or adverse effects. And now, these usually are characterized by more severe symptoms. Okay, that's the meaning of adverse. Adverse means severe symptoms or problems that develop due to the administration of a normal dose of a drug. For example, and I'll be showing you pictures later on when we start rational use of medicines. Okay, if I take, let's say, paracetamol, okay, paracetamol and other medicine can cause something called Steve Johnson's disease, where the whole skin of the person is peeling off. We call that one the adverse drug reactions, okay? And it can be very dangerous. If you're not careful, it can even kill a patient. Then we have another one, and that's going to be the eighth one. We call it the idiosyncratic reactions. Idiosyncratic reactions, okay? So this refers to when a patient has experienced a unique, strange, or unpredictable reaction to a drug. Okay, so we are adding to their vocabularies. When you say something is idiosyncratic, it means that we don't know the origin. Okay, so sometimes a patient, for example, may buy vitamin C, normal vitamin C tablets. They'll take their vitamin C tablets, and within a few minutes, they are bleeding from their nose. Okay, so assuming you take vitamin C and you're bleeding from your nose, we refer to that type of reaction as a unique, strange, or unpredictable reaction. It's not part of what you are documented vitamin C to do, but if it's doing that, you see the patient is having an idiosyncratic reaction. The ninth point, still under the pharmacodynamics, what can medicines do to the body, is that medicine can produce hypersensitivity or allergies. Hypersensitivities or allergies. So allergies or hypersensitivities reactions are another type of unpredictable reaction caused in some patients by drugs. Okay, and this can include aspirin. Okay, when you take aspirin, some people are there that they will start to react. Okay, penicillins, okay, amoxicillin, flucloxacillin, and sulfur-containing medicines. Okay, they start to react, and sometimes if you are not careful, they will die. They have a lot of reactions that is going on. And that's why some people say that for my body doesn't like. And that's why when they come to the pharmacy, they'll tell you that, boss, madam, sister, brother, please, my body doesn't like paracetamol. My body doesn't like brufen. My body doesn't like chloroquine. If you give it to me, my whole body is itching. So please, I don't want any medicine with chloroquine. What our patient is telling that they are hypersensitive or they have allergies to that particular medicine. And the last point, still under the pharmacodynamics, is called the anaphylactic reaction. Anaphylactic reaction. So, an anaphylactic reaction to a drug is a severe form of allergic reaction that is life-threatening. Okay, this one is life-threatening, closer to adverse drug reaction. But for this one, if you don't act quickly, you may lose the patient. So the patient develops a severe shortness of breath. They can't breathe. Okay, they will be wheezing. Okay, I know we know wheezing. Okay, they'll be doing that sound. Okay, like okay, that's what we call wheezing. It's very common with asthmatics, and they may even have cardiac collapse or heart attack. An anaphylactic reaction is true medical emergency because the patient may exhibit paralysis of the diaphragm. Okay, the diaphragm is where the lungs are. It holds the lungs and everything. The whole diaphragm will be paralyzed. And there'll be swelling of the oropharynx, okay, where the throat, basically I'm talking about the throat. When there's swelling in your throat, it blocks your ability to breathe. Okay, so when there's swelling of the oropharynx, it leads to inability to breathe and the patient can easily die. Okay. So please, when any patient buys a medicine, takes medicine, and they're having an anaphylactic reaction, we should quickly rush them to the hospital where a medicine is given to reverse the reaction. These things are reversible, but if we delay, they may die. Okay. Now let's talk about the second part of the pharmacology. So what we just finished is pharmacodynamics under pharmacology. I said pharmacology has gotten two parts: pharmacodynamics and pharmacokinetics. So now we are on pharmacokinetics. So pharmacokinetics, okay, kinetics basically means movement of drug through the system. Is the study of the action of drugs within the body, including how the medicines are absorbed, that's mechanism of absorption, they are distributed, metabolized, and excreted. Okay. So basically I have called it ADME, 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 absorption, distribution, metabolism, and elimination. These are the four main things you should know under pharmacokinetics. Only four: absorption, distribution, metabolism, and elimination, popularly called ADME. Alright. So pharmacokinetic interactions occur when one drug alters the absorption, distribution, metabolism, or excretion of another. Thus, it may either increase or reduce the amount of a drug available to produce its pharmacological effects. Now, let's go into details of what I mean. When you talk about drug absorption, it talks about the movement of drugs from the site of administration into the bloodstream. Okay, that's what we mean by drug absorption. Okay, so when the medicine moves from the site where it was administered into the bloodstream, it's referred to as absorption. Now, when drugs are given orally, when we swallow them, okay, it comes through the stomach, it's dissolved in the stomach, then it enters the small intestines where it is the primary source of absorption, okay, the primary site of absorption. Okay, this is because the small intestines have gotten a large surface area, okay, where it can easily diffuse. Now, let me give you an example here before we continue. Those of us that we have seen people preparing palm nut soup, abenquine, okay, if you've prepared it before, or if you have seen it before, after we have pounded the nuts and gotten the whole flesh off the nuts, okay, I've seen ladies preparing, okay, where we have the chaff, okay, after we have finished pounding it, we add some small water and we use a sieve to squeeze the juice out of it to prepare the abenquine. Now the sieve we use is acting as the small intestines, okay, and the liquid that is coming out is like a drug. The chaff, the nuts, and the fiber that we see inside the sieve, the soye inside the sieve, is what we throw away. So that will come as feces. All right. So that's the work of the small intestine. So the small intestine is like a big sieve. If we have a big sieve, that means that we can use a short time to filter a large amount of the medicine. Okay. So basically, so after the medicine has been absorbed from the small intestines, the medicine enters the liver, okay, where the medicine is partially metabolized, partially broken down by the liver. Okay, so the liver is a very important organ, okay, connected to our small intestines to partially metabolize medicine so that it reduces how strong the medicine is. We call this one the first pass effect, okay, before the medicine enters the blood. People that normally drink alcohol, that is why alcohol destroys our liver, because anytime you drink a lot of alcohol, it comes into your small intestine. Your small intestine absorbs the alcohol, and all the alcohol have to go through your liver. Your liver will try to reduce the strength of the alcohol so that it doesn't collapse the whole system. All right, so when you're taking alcohol too much, obviously you're destroying your liver. Okay, we call this one the first pass effect. The first pass effect. All right. So after the blood have entered into the blood, it produces what we call the systemic effect. We've done this already. I've talked about local effects and the systemic effect. When a drug is rather injected, okay, if the drug is not soluble but it's injected directly into the bloodstream, that is the veins, okay, intravenous, okay, what we say that you have placed a drip on the person, the drip person is so, all right, so that's the veins or the arteries or the muscles, okay, where they are giving injection at your thigh or at your backside or buttocks or other injection sites. Anytime that we jumped the intestine and we are giving the blood directly into the bloodstream, absorption doesn't occur again because we have jumped absorption. Okay, then we come straight to distribution, okay, where the medicine is distributed. So now question number 5, let me ask this question. Which one do you think will be faster? A medicine that is given through the mouth, given orally, for it to come into the systemic effects, or a medicine that is injected into the bloodstream? Which one do you think is faster? Is it a medicine that was given through the oral route or a medicine that was injected directly into the bloodstream? Which one is faster? That's question number 5. Question number 6. Please note. Question number 6. Take note of the question. Which one do you think it is safer? Medicine given orally through the mouth for it to be absorbed in the intestine, okay, or medicine that we give by injection to the bloodstream for it to be distributed immediately. Which one do you think is safer? All right, so I've asked 2 questions on this slide. The first question I asked here, which is also our question number 5, is which one do you think is faster? Is it the oral route or giving medicine straight by injection? The question number 6 that I asked on this same slide, that which one do you think is safer? To give medicines through the mouth, to be swallowed, to be absorbed from the intestine, or to inject medicines through our bloodstream? All right, so that's the question number 6. Now let's continue with our presentation. The next one is drug distribution. Now, distribution basically is the process by which drug molecules leave the bloodstream and enters the tissue of the body. Okay, now let me just use this as an example. If we have the medicine in the bloodstream, this medicine must enter the body's tissues and organs. So you have to go to your liver, your heart. Assuming somebody takes a contraceptive like Postinol 2 and you swallow, Postinol 2 is going to be absorbed in your intestines. It will enter through the liver, the first part first. Now it will enter into the blood. Now, where do we want Postinol 2 to work? Where is Postinol 2 going to work? Anybody? Okay, you are right. Postinol 2 is going to work on the ovaries of a lady. Alright, so if Postinol 2 is taken and it cannot be distributed to the ovaries, to the reproductive system of the lady, she's going to get pregnant and I'm sure she'll get twins. Alright, so Postinol 2 should be distributed. Once it enters the blood, it should be distributed into the tissues of the reproductive system of the lady. And I'm talking about her ovaries, where she has gotten her eggs, so that she doesn't get pregnant. All right. When a drug reaches the bloodstream, it is ready to travel through the blood, the lymphatics, and other fluid to assist inside. Okay, so sometimes if there are other fluids like breast milk, the blood can take the medicine there, saliva, semen, okay, and all those fluids. Sometimes we can find the medicine inside. Now, for the drug to reach size beyond the major organs, a drug may have to pass over the lipid membranes. And for here, this one, I don't want to worry you. Okay, lipid membranes are like covering on our body cells. It's lipid or fat membranes. And this one protects the cells. The drug will have to pass through. The rate of distribution is highly dependent on the blood flow to the various organs. Basically, if blood is flowing more to a particular organ, that means that more of the medicine will go there. If blood is not flowing very well to that particular organ, then the medicine will not get there. All right. So assuming somebody have gotten an infection, and where the infection is, the blood cannot reach there. If you take that medicine, you have wasted your money. Why? Because the blood is not going there. Therefore, the medicine cannot be distributed, okay, to that place. It's just like buying a cell phone to an area where there's no reception. You can't make any call. All right. So even though you have bought the cell phone, does not mean that you'll be able to make a call, unless, of course, there's a reception at the place where you are. Okay. Let's talk about the next one. The next one talks about drug metabolism. Drug metabolism. Now, the overwhelming majority of drugs undergo metabolism after they enter the body. Now, when you talk about metabolism, we are basically talking about the fact that drugs, when you take into our body, should be broken down. They should be destroyed. Okay, if we take blood into our system and our body cannot destroy the drugs, these drugs will become poisonous and kill us. So it's important that anytime we take drugs, our body should have the ability to destroy the medicine within a particular time range. So most drugs are acted upon by enzymes in the body and are converted to metabolic derivatives during metabolism. Okay, so they are converted to other forms basically. The process of conversion is called biotransformation. Okay, so biotransformation is the process whereby the medicine is transformed to its metabolic derivatives. In most cases, biotransformation can terminate the pharmacological action of the drug and increase the removal of the drug from the body. Now, for the body to be able to remove the drug, that's the last elimination, the drug has to first to be metabolized. Okay. There are some drugs that they are rather active after they are metabolized. Okay, once they metabolize, they start to work on the body. But if they are not metabolized, they are not working. There are some drugs like that. Okay, but most drugs will be metabolized so that their effects will come down. Now, please take note. The liver is the major site of biotransformation. The liver is the major site of biotransformation. Now, when we talked about absorption, we talked about the small intestine. Okay, when I'm talking about distribution, we talked about the bloodstream. Okay, so absorption, small intestine, distribution, the bloodstream. Metabolism is the liver. Please take note of these key things. They are very important. Okay, metabolism is the liver. So drug metabolism influences drug action, such as the duration of the drug effects, drug interactions, drug activation, and drug toxicity. I've talked about it already. If the drug cannot be metabolized, it becomes toxic and it can kill the patient. If the drug cannot be metabolized, it will act for a longer time in our body, and that can be very, very dangerous. Okay. And the last one on pharmacokinetics is called excretion. Okay, so the ADME, that's the last E. Excretion is the process of eliminating the drugs from the body. Okay, now drugs may be excreted from the body in many forms, including through our urine, feces, saliva, sweat, breast milk, through our breath, like those who take a lot of alcohol, hypotension, or garlic. When they are breathing, you can smell the medicine in their breath. And also sometimes through tears when they are crying. However, the kidney is the major site of excretion for most drugs. Alright, so when you take certain medicines and you're even urinating, you can see the color of the urine changes and the smell of the urine may even change, okay? Because the kidney is the major site of excretion for most drugs. Alright, so please, when I ask you that, and that is going to be your question number 7, okay, when it has to do with pharmacokinetics, okay, state four four body parts that are useful in ensuring the pharmacokinetic properties of medicine. State four body parts, four parts of our body that is involved in pharmacokinetics of a drug. Okay, state four body parts that are involved in pharmacokinetics of a drug. So this is question number 7. All right, question number 7. So, patients at increased risk from drug interactions include the elderly and those with impaired renal or liver function. Now, once we take a medicine and it cannot come out from the body, we are dying. And we are saying that patients with increased risk during interactions include the elderly and those with impaired. Normally, when people grow, they may have an impaired renal function. Renal is the same as the kidney, okay, or hepatic function. Okay, hepatic is the same as the liver. So, hepatic is liver, renal is kidney. Okay, now let's come to the next one, the drug indications. So we are finished with the pharmacological properties. We are talking about product literature still, let's not forget. Okay, we have talked about the product description. The second thing I talked about was clinical pharmacology. And clinical pharmacology, we discussed pharmacodynamics and pharmacokinetics. Now we are on the third one, indication and usage on the product literature. Now this refers to the uses or indication of what the medicine should be used for. Okay, what was the medicine approved by the Food and Drugs Authority to do? Is it for migraines or seizures or high blood pressure or cholesterol? What is the medicine supposed to do? It's very important. Now, this is important because anytime a patient comes to a pharmacy, they may ask, Madam, please, what do we use this medicine for? You can take the product literature, and most often than not, the manufacturer will indicate what the product is used for. All right. Prescribers legally can and often do prescribe medicines for purposes not listed in this section, the so-called off-label users. Okay, for example, when COVID-19 came, all right, we all heard that they were using hydroxychloroquine and chloroquine in treating, all right, and another antibiotic called azithromycin. These medicines were not used for COVID-19. However, that has been an off-label use. We have seen that chloroquine or hydroxychloroquine is effective in some patients with COVID-19. All right, so here hydroxychloroquine was being used in the management of COVID-19 patients. Now, this does not mean that medication is being used inappropriately. No, but you see, medicines, we are still learning about a lot of medicine. Medicines that are very old are still showing up a lot of things they can do. So before providing the patient with the drug information, it is very important to know why they are taking the medicine. This is, forgive me to say, but this is common sense. It is dangerous for us to give any medicine to a patient in a pharmacy and the patient will ask, now, Madam, boss, say, sister, please, what do we use the medicine for? And we say we don't know. Go and ask the doctor, did I prescribe the medicine? Okay, some of us even give them a cheeky answer. It tells us that we are not competent to work in the pharmacy. Before you give a medicine, ask yourself, what do we use the medicine for? And the place you can go is simple product literature. Inside the product, you can pick it out and read what the manufacturer has indicated the product to be used for. If what the doctor has written is not on the literature, we are all supposed to work under the supervision of a pharmacist. Call the pharmacist, let him be aware, and the pharmacist will tell you what the medicine do. Most pharmacists, in fact, all pharmacists are qualified and trained, and they know. Okay, so if the doctor maybe has prescribed wrongly, the pharmacist will be the best person to consult, and he can call the doctor for appropriate change of the medicine or otherwise. The next one is dosage and administration. How much of the medicines do we take and how should I take it? That's the meaning of dosage administration. So this section explains the Food and Drugs Authority recommended doses of the medication and how to take the medicine. This section can be very important to find if a patient should take the medicine with or without food. Okay, and a lot of our patients will be asking you, okay, this medicine, should I take it with food or I should take it after food? Okay, it is important because if they are not supposed to take it with the food and you ask them to take it with food, the medicine may not work. All right. What time of the day should I take my medicine? All right. What time of the day should I take my medicine? Can I take it with the cold water? Can I take it with the orange juice? Can I take the pineapple juice? All right. So this session will give you that answer. It is also very important to note that sometimes different dosages are recommended based on the patient health problems or other medications they are also taking. So maybe the manufacturer is saying that the patient take 2 tablets 3 times a day, and the doctor have said the patient to take 1 tablet twice a day instead of what the manufacturer recommended 2 tablets 3 times a day. Anytime you see certain things like that, don't be in a haste to say that the doctor have committed a blunder or an error. Sometimes the patient may have a poor health state or may be taking other medicines, and that's why the doctor might have altered the dosage for the patient. All right. And as I've said, always speak with the pharmacist. You work under the pharmacist, and you'll be the best person to consult. All right, in that situation. There are some medications that may need to be reduced. Okay, as I've said, based on because the patient may have a poor or weak liver or kidney function, okay, or because the medicines are metabolized by the liver, and because of that, the patient may need special dosages. Another one that we should know is called contraindications. Contraindications are the conditions a patient may have that may not permit them to take particular medicines, basically. Okay, so this section lists in situations or conditions in which the medicine should not be used. There are certain medical conditions that may put a patient at higher risk for dangerous side effects if they use the medicine. For example, I'm giving tetracycline. Tetracycline cannot be used in pregnant women because if they do, the tetracycline molecule colors all the bone of the child brownish yellowish, okay, or yellowish brown, sorry, yellowish brown. So you give birth to this child and they are growing and their teeth is yellowish, and this is permanent coloration of the teeth. No toothpaste in this world can change the color of their teeth. Their teeth will always be yellowish brown. People may think the child did not brush well. No, it's because the mother took tetracycline when she was pregnant with a baby. Okay, so tetracycline is contraindicated in pregnancy. Another one is misoprostol. The popular name is Cytotec. Yes, I know some of you may know what we use Cytotec for. Okay, abortions. So if you accidentally give Cytotec to a pregnant woman, then you are doomed because you're going to abort the pregnancy. Even though some doctors will use to induce labor, okay, when the lady has gotten to term and they want to force labor, they may use misoprostol. But what I'm saying is that misoprostol itself is contraindicated in pregnancy because it can terminate the pregnancy. Another one is thalidomide. This one can cause deformation. Later, I'll show you some pictures. Okay, in maybe lesson number 4, part 4, we'll talk more about it. So when you say a medicine is contraindicated, it means that there is conditions under which this medicine cannot be used because it can cause serious effects to the lives of our patients. The next one is warnings. Okay, now warnings normally cover possible serious side effects that may occur when you take the medicine. For example, most common cold medicines may cause dizziness when taken, so the patient should be warned not to operate machinery. So when you are driving and you're on these medicines, you may be dazed and it can result in the loss of life, properties, and injuries. All right. So medicines like common cold medicine and cough medicines are not supposed to be taken while somebody is operating machinery. And anytime you are giving a medicine, please check the warnings. Okay, and advise the patient appropriately that if they are driving, they should wait till they get home or they should let somebody drive. They cannot take their medicine and be driving. All right. Another one is precautions. Now, precautions explain how to use the medicine safely, including whether the medicine can have any physical impairments and drug interaction. Okay, for example, we ask patients not to drink alcohol while taking this medicine. The simple example I gave, if somebody is taking a common cold medicine and add alcohol, the effect is going to be very strong. Okay, so that's a precaution that I normally give. Another precaution is when we take antibiotics. Okay, we should normally not take it with milk. Okay, that's a common precaution because milk may affect the absorption of most antibiotics. All right. There's another one we talked about it earlier, and you can see it's coming again. When we talk about pharmacodynamics, I talk about adverse reactions, and this section lists all side effects that were reported whilst the medication was being studied in clinical trials, including uncommon side effects. Alright, so these adverse reactions are documented and they are also part of the product literature. Many patients may read this section and may be hesitant to use the medication because of the side effects listed. And this is very key that we don't use this one to scare them. Alright, because sometimes there's always what we call the benefits and the risks. Okay, so often the percentage of patients that the side effects occur in is listed, and sometimes they are very few. Okay, so the benefit of using the medicine should outweigh the risk of having a side effect. For example, as I've said earlier, if somebody is taking hypertension medicine, a man is taking hypertension medicine, and he can see the side effect is erectile dysfunctioning, okay, which they may not be able to have sex. And the man is going for the fact that if I'm going to have erectile dysfunction, I'm not going to take the medicine. The benefit of using the medicine far outweighs the side effects. So if you're not taking your medicine for hypertension, you're going to get a stroke and you may die. Okay, but you can live with erectile dysfunction, and even that there's a way we can go about it if it becomes an issue at the pharmacy. Another one is drug abuse and dependence. Drug abuse and dependence. Now, most drugs that will cause dependence and abuse, not all, will be stated. Example is what I'm showing, the tramadol, where if they will ask you to take a particular dose and not for too long a time. Why? Because you can get addicted to the medicine and you cannot live your life without the medicine. So tramadol is one, codeine is one, morphine is one. We know people who are now taking a lot of medicine from the pharmacy, and the tramadol became a big issue in this country. All right, because we are not appropriately reading the instructions. So sometimes patients are finding a wise way of coming to the pharmacy to buy another medicine that is causing addiction. And we are selling without even knowing that these medicines are causing addiction. And now know that they are taking other cough measures. All right. So please let's always check whether this medicine can cause addiction and dependence, which can destroy the life of our patients. Okay. Another one is overdosage. What should the patient do when they take an overdose? So this is very important, especially where you have children. I've had cases where a mother left a bottle of a blood tonic or something, a child to overdose, and you call me that what should we do? Alright, normally the manufacturer will indicate what should be done. Either contact the poison control, or the patient should drink a lot of milk, or the patient should take an artificial charcoal. Okay. So there's also an instruction on overdosage of the medicine. Now the next one we will talking about still is what's called drug interactions. Okay, drug interactions basically talk about what can affect a drug so that it's not even absorbed at all, or if it's absorbed, it doesn't produce effect. And this can be a drug interaction. So you can have a drug interaction where two drugs are interacting so that the patient don't have a result. We can have a drug food interaction. There are some foods that we are not supposed to take, or we are supposed to take certain drugs. There could be supplements or other medical conditions. Okay. And a possible effect is that it may decrease the action of the drugs, it may either increase the action of the drug or cause adverse effects. Okay. So a drug reaction is an interference of a drug with the effect of another drug, nutrient, or laboratory test. This is very important. I've seen some patients taking a particular drug that when they go and do a lab results, their blood sugar is high. And if you're not careful, you may say the patient is diabetic. Meanwhile, they are not diabetic. There are some drugs that when you take and do a pregnancy test, you may be seem to be pregnant. Meanwhile, you are not pregnant. All right. So these are all called drug interaction. In addition, a drug interaction is possible if a food interferes with the action of the drug. I've talked about it. And the one common example is milk. Okay, milk cannot be taken with a lot of antibiotics, including tetracycline, because it will not allow tetracycline to be absorbed. All right. There are some foods that rather will even help food to be medicine to be absorbed. Okay, like taking lonuts and a fatty meal is good because it helps lonut to be absorbed, or artemether lumefantrine to be absorbed better. Drug interaction is usually the result of a patient receiving more than one drug concurrently. Okay, so where a patient have two or more drugs, we should be careful. Anytime a doctor prescribe two or more drugs for a patient, we should read and see whether this medicine the patient is taking will interact with each other or not. All right. Then the next one is to understand the mechanism of drug interaction. Let's discuss this three. We call it synergism, potentiation, and antagonism. So when you talk about synergism or synergy, synergism refers to the cooperative effect of two or more drugs given together to produce a stronger effect than that of either drug given alone. And normally, I want to give a simple example of a cartoon we used to watch when we were kids. I don't know whether some of you watch. It was called Captain Planet, okay? And let our powers combine. Normally, that is synergism or synergy, where we have two medicines that the effect that they give together is stronger than if we took them alone. Okay, so we have some medicines like, for example, paracetamol, brufen combined, and the two of the medicine will give a stronger effect if they are taken together than they are taken alone. So when two drugs with similar actions are taken, the effect of the drugs will be doubled. Synergism is the working together of two drugs to produce a strong effect than that expected for each drug when taken alone. Sometimes synergism is desirable. Okay, like in antibiotics, there's an antibiotic we call co-amoxiclav. Okay, it's amoxicillin and clavulanic acid. Okay, like augmentin, amoxiclav, and the like. Okay, it's desirable because when you add it, it's able to kill the germs better, and the germs can't overcome the medicine because it's stronger. Sometimes too, it could also be dangerous when the two medicines are combined. For example, if a patient combines a medicine like diazepam, okay, with a medicine that has also gotten a stronger effect on sleeping. So somebody's combining diazepam with another medicine like Piriton, okay, taking the two together because the two of them can be very dangerous and can lead to the death of a patient. We also have another we call potentiation. Now, please take note between potentiation and synergism. It's very much confusing. Potentiation occurs as one drug prolongs the effects of another drug. All right. So let's say that I take paracetamol, and paracetamol is supposed to work for 2 hours, but because I've added on another medicine, Paracetamol is now acting for 6 hours. We call that one potentiation. All right. So an example is the combination of paracetamol, Tylenol, and codeine. Okay, so paracetamol and codeine for the relief of pain or fever. So the time is prolonged for them to react. So desirable potentiation is a wanted effect used to build up a drug level in the body or to prolong its effect. Now, when toxic effects occur from drug potentiation, the potentiation is undesirable. There are sometimes that, for example, a patient is going to do a surgery and maybe they took alcohol, but they never told the doctor that they took alcohol. And that can lead to potentiation, whereby after the surgery, this patient is not waking up because the effect of the anesthesia has been prolonged because the patient took another medicine before coming. So normally, if you are going to do surgeries, doctor will tell you don't take any other medicine because they don't want to take any chances. All right, and the patient may die. And the last one, still under what the effects of drug interaction may call, is called antagonism. Antagonism occurs when two drugs decrease the effects of each other. An example is ibuprofen and aspirin, which, when taken together, stops each other's action. All right, so they fight each other. That's why we call them antagonists. Antagonism. Antagonism may be desirable to stop the effects of a medicine. For example, activated charcoal is used to stop the effect of a syrup IPEC. Okay, IPEC means ipecacuanha. Okay, it causes serious vomiting for a drug overdose or poisoning. Okay, so assuming somebody takes ipecacuanha and is vomiting, we give activated charcoal, is able to stop it. Okay, so here we can see that the activated charcoal is antagonizing the syrup of IPEC. Okay, so that the patient doesn't die. Sometimes it can be undesirable, and the undesirable effect is an example of tetracycline and antacids taken together. When you take these two medicines together, it cancels out. A tetracycline is not absorbed, and the patient may have the infection. Okay. The next one that we'll talk about is the manufacturer supply, and this will be bringing our lecture to an end. Now, this section explains in detail the physical characteristics of the medication, including color, shape, markings, etc. And the storage information, it should be stored between 68 and 78 degrees Fahrenheit. Okay. Now, the Food and Drugs Regulation states that every drug label must include the name of the manufacturer, the expiry date, and abbreviated ESP, after which the drug may no longer be used. Okay, that's the expiry date and the lot number. We've talked about the lot numbers already, that medicines are produced in batches called as lots, and the lot number is a code that indicates when and where a medicine was produced. It allows the manufacturer to trace problems linked, okay, to a particular batch. All right. And the last one is if a manufacturer has removed an entire lot from the market because of contamination, suspected tampering, or unexpected side effects, the lot number helps us to identify the medicines easily. All right, so thank you very much. This is the end of today's lessons, and I've given you 8 good questions. Please answer them and send it through my email. I'll be waiting for it. Thank you and enjoy the rest of your stay. God willing, on Wednesday, there'll be another lecture on rational use of medicine. Bye bye.